I'm glad to see that still we have spectators and audience, and they're still willing to hear another few more minutes. And I won't take most of your time. And I don't know if this is an irony or a privilege. And we heard quite a lot about women's empowerment. And I don't know whether Maitri didn't get a women to come and summarize it. Maybe I'm not that much a man to claim at a manhood, so maybe I'm a less of a man or from more of a woman. I don't know which way it is. So we had about 15 speakers today, and most of the speakers, they presented a wide variety of expertise, experience, and also insights brought in. And it's extremely difficult to summarize all this within few minutes. But I'll just highlight maybe one or two sentences each from most of the expert speakers, what they try to present within 5 to 10 minutes. Vinny, in her opening statement, she said, Maitri is providing a space for a dialogue on an issue which demands an urgent attention. So as she mentioned in the opening remark, this was a vibrant and very encouraging space for a debate on a wide variety of issues related to the domestic violence. And Kathleen, from the Director of Work Foundation, opened the presentation with a call to think out of the box about the empowerment, what is empowerment means, and need for involving men as an important take-home message from Kathleen. But this particular message is reiterated and echoed by many other speakers that the need to work with men and boys to look at the issue of domestic violence in terms of an intervention in terms of how to reduce the impact of domestic violence. There's a need to work with men and boys. That message, we heard it from many of the speakers echoing it. And also anything about reducing domestic violence should be based on the provision of long-term support. That's another key message presented by Kathleen. Wolf, he chaired the session and he gave a wider framework for the discussion, and he presented the framework from the beginning itself. And Dr. Najma Heptullah, she reminded us there are more than 40 laws directly related to the women's empowerment in India. But in the question and answer session, she reminded us that an example of marshals from the assembly forcefully removing some of the men to pass a law which is protecting the empowerment of women in the Indian history of the legislative process. So that's an interesting insight from an experienced and long-term legislator from Indian legislative fraternity. And also, she mentioned about the inbuilt checks and balance in the legislative process. She briefly explained about even when there are gender-related laws there are systems to make sure that those laws are working. But she also noticed that those laws are not necessarily working in the real sense. That means not because we don't have enough laws, the empowerment issue is not taking place. The issue of education issue of, again, working with men and women, men and boys as a key issue was reiterated by Najma Heptullah also. And one of the observation articulated from one of the audience was that the changes also need to come from men's mental outlook. Empowerment is much more than economic empowerment, and it's about working on the men's mental outlook about domestic violence and gender equality. Partnership of men and women is essential for women's empowerment and to reduce the violence against women. That's reiterated by the second speaker also. And one of the issues which was not an issue which didn't get much attention is the issue of dowry. And one of the audience, he mentioned that acceptance of dowry is also a form of a violence against women. And the light should enlighten the mind of the world. And this is mentioning about the Najma Heptullah again. She was referring about the ritual of lighting the lamp. She said this ritual of lighting the lamp should be, each participant should act as a light, and that lamp should be shared by other people in our life, and that may be the message we can take home, that the message that women's empowerment is everybody's business. That is what is articulated through the lighting of the lamp. And the plenary session 1, Dr. Mridula Bandyopadhyay, she mentioned about acid violence. And acid violence is a deliberate attempt to disfigure, and acid violence seldom kills, and it's a deliberate attempt for maiming, and it's an act of control, it's an act of violence with a particular view of exercising power and control of a person in a domestic relationship. And women, immigration and violence by the intimate partners, and this was articulated by Maushima Gangopadhyaya, and mostly based on experience from South Asian women and their domestic violence, and in the context of the United States and the migrant experience. And for example, in even some of the social structural factors are contributing towards increasing domestic violence, and why the survivors are forced to remain in the relationship which are essentially or clearly violence oriented. But for example, some of the visa categories of the immigrant spouses are not allowed them to work. That reduce their empowerment and their capacity to look for alternatives and ways to get out of a disempowering relationship. Barriers: lack of resources, lack of social support, lack of education, lack of skill, lack of knowledge, lack of appropriate support, lack of information, inappropriate language are some of the issues articulated as the reasons for why some individuals remain in disempowering and violent relationship. And fear as a tool, and how that fear is used as a tool for perpetuating intimate domestic violence, is also articulated by many speakers. Dr. Ravi Verma articulated the current thinking on alcohol and domestic violence, and he noticed that alcohol and domestic violence has linkages, but we have very limited data to explain the relationship. And for him, the issue of alcohol use is an issue of the gender inequity, and it's amplified through the use of alcohol, and it gives an excuse for amplifying gender inequity. And also there's a need for developing strong evidence base for establishing the linkages between alcohol and domestic violence. And he articulated that domestic violence is an issue of a multi-layered experience, and the use of alcohol is one aspect of this multi-dimensional social phenomena. And some men and boys would like to question the gender inequity, but they are also afraid to do so because of their socialization pattern, the way they brought up, and their socialization, the values they inculcated, which force them to, which frightens to take a position which will lead towards re-examining the gender equity equations. One of the interesting observations from Dr. Ravi Verma was that Indian schools are the primary institutions which promotes violence against women. That is a very powerful statement. That's one of the unique insights shared by Dr. Ravi Verma, which may be one of the powerful take-home message for many of us. And also he noticed and emphasized the issue of structural roots of domestic violence are not looked into carefully, that which we may have to look at deeper into the issue of structural root of domestic violence. Dr. Urvashi Gandhi, from the Breakthrough, she looked at the issue of multimedia as an effective tool for creating awareness and education among domestic violence. And she articulated the issue of a Bell Bajao campaign as an example of how multimedia campaign could be used for domestic violence awareness and education. And the plenary session 2, Uniform Service and Violence Against Women. And General Bhumendra Singh's personal testimony was extremely powerful, and he made a very moving personal testimony about his personal involvement about the issue of domestic violence, and that may be one of the most strong take-home message that Indian generals are one of the most powerful men in the country, and he presented his softer side of the how when he articulated his personal testimony. The plenary session 3, Dr. Ariel mentioned about the public health approach towards violence prevention and what works. She presented a global review and global overview about based on some of the global research. And she reiterated the need for working with men and boys again to deal with the issue of domestic violence and the gender-based violence. Dr. Ritu Mahendra tried to explain the issue of a conceptual framework, a theoretical framework, intersectionality of domestic violence, and how intersectionality could be used to understand the issue of domestic violence, and taking intersectional approach to understand the issue of domestic violence and the possible service delivery and possible support services for domestic violence related issues. Rini Balsaria presentation about real men don't beat their wives presented an empirical evidence and empirical data on the issue related to domestic violence, and it seems exposure to the the culture of violence is not essentially a source of domestic violence. It seems many of the young boys who are exposed to domestic violence in their own immediate environment, and sometimes they take a position that we don't want to be part of such cultural norms and cultural values. And she also underlined the need for teaching men and boys to deal with domestic violence at an early stage, and need for early intervention at the healthcare setting. Healthcare providers are one of the strong institutional support which may be able to provide much needed support at the early stages, and the need for coming out with screening facilities at the healthcare setting is presented as an example by Rini Belsaria. Madrimeo from Jadavpur University spoke about women negotiating violence and case studies from West Bengal, provided data and pattern of how women using domestic violence support services, and particularly counselors and protection officers are identified as a crucial instrument, crucial link towards who could provide critical role for providing support services, which was not an issue which was widely shared by other people. And probably the understanding that counselors and the protection officers play a critical role in providing much needed support services may be an important take-home message. And Dr. Kanna Chibar from Max Healthcare informed us about working with women who experience domestic violence, and the very individual experience of domestic violence is different from each one. So we may not be able to come out with any particular pattern which which develops support services or policies. We may have to take into consideration of how women experience domestic violence, and how individually they experience domestic violence is different from each one. So that particular message is a powerful message when we have to take into consideration when we look at the issue of policy making and program making. And as a fitting conclusion for the session, Dr. Sonal Mansingh, she reminded us how art can be a great mediator of human life, and performing art is an important link to an awareness of our consciousness, and how issues like domestic violence could be presented, reiterated, and also re-examined through the art form. And I would say that that's one of the most fitting conclusion of the session. Thank you very much for everybody who had the patience to stay on to listen to the last minute. And thank you for the privilege of for me to present this summary within 2 minutes of a 14 speakers presentation and the insight. And I know that I didn't do much justice to that presentation, but I made my attempt, and I hope that much I'm man enough. Thank you.